Toronto Public Health is urging people to make sure they are vaccinated against invasive meningococcal disease following a rise in cases. For the latest, we're joined live by Dr. Vinita Dubé, Associate Medical Officer of Health. Dr. Dubé, it's good to be with you. Thank you for joining us.
Absolutely.
So what's happening? We now have 13 cases reported to public health. That's the highest number of infections since 2002, and it's only June.
That's right. We usually will see about 6 cases a year, and we're just at the beginning of June and have already seen 13. So it is certainly an increase and something that we can certainly do something about.
So for those who don't know, what is meningococcal disease, and when can this bacterial infection turn deadly, doctor?
It's caused by a bacteria called Neisseria meningitidis, and it can give you an infection in your blood called bacteremia. It can give you meningitis. It can make you very, very sick very, very quickly, and can sometimes be fatal as well.
And have you figured out, as a public health unit, what is behind this sharp rise in cases?
We have seen 13 cases, which is more than we expect to see. We do know that other parts of the world have seen a rise in cases. The U.S. has noted a dramatic increase in their number of meningococcal cases as well. It's probably related to behaviors. More people are out. It's spread through saliva. Maybe they're sharing more drinks in close quarters with people. And so the bacteria is here. It's here in our city. If you travel, you can acquire it. And that's probably why we're seeing an increase, because it is spreading.
So you are now urging people to get vaccinated against this infection. What's the public health message there?
First and foremost, if you're traveling, including those who may be going to Mecca or Hajj next week, make sure that you're vaccinated. Those who will be participating in international pride events, for example, those events where there's a lot of people, mass gatherings, the outbreaks have been noted. So that's one piece. The other piece is for parents. Your children should be vaccinated. There are 2 vaccines that are commonly given at 1 year of age and at grade 7. Many high school students may have missed it from the pandemic. And so at least let's make sure that they're all up to date. And finally, any adult who's between 18 to 36 who never got a meningococcal vaccine, they're still eligible for free vaccine. So they can see their doctor about that.
When it comes to vaccination data, do you have that data? I know with measles, the city is still trying to figure out who's been vaccinated, who hasn't been vaccinated. What does that picture look like?
We know for meningococcal, because it's just 1 dose, the rates are better than, say, for measles. But we, again, want our rates to be at 100%, because we know that the vaccine works very well. And if someone gets this illness, they can actually get very, very sick very quickly. And so the vaccine is actually really our best way to treat this, to prevent this, because even though we have antibiotics, sometimes we can't treat the person quick enough.
And Dr. Dubé, for any parent watching this, how do you watch for symptoms?
The commonest symptoms are high fever, really not feeling well, headache, vomiting, and then you can get more severe symptoms more quickly. So in someone who also has a stiff neck, a child or an adult who's not feeling well, especially if they've traveled, they should mention that when they get assessed.
Dr. Vinita Dubé, Associate Medical Officer of Health. We really appreciate this. Thank you.
You're welcome.